On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I'd like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon and I work for Kaufman & Associates. I will be the moderator for today's webinar. Today's webinar is Protecting Voters Ages 50 Plus. Before we begin, I'd like to highlight the main features of your Zoom webinar interface. First, the presentation slides are the main window. The presenter camera appears at the top of the webinar screen. You can adjust the location of the presenter view as needed. At the top of your screen is the Zoom, at the bottom of your screen is the Zoom menu bar. You will find the chat box. We encourage you to use this feature to submit any questions you may have for our presenter at any point during the webinar. When sending a question using chat, please direct your message to panelists and attendees, so that everyone can follow along with submitted questions. You can also use the chat box to report any technical issues you may be experiencing. We will respond to those concerns as they come in. Another menu option is the raised hand icon. Please use this feature when you'd like to unmute your line to ask a question aloud. Additionally, closed captioning is available during today's broadcast. Simply click the CC icon from your bottom menu bar to use this feature. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. If you would like a copy of the slides sent to you directly, please email ltssinfo@kaufmaninc.com. With those announcements made, I'd like to welcome everyone to today's webinar. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. We have with us today Charmaine Fuller-Cooper. Charmaine is the South Region Campaign Field Manager for AARP. Thank you for joining us today. We will now transition to Charmaine to introduce today's topic.
Good afternoon, everyone, or good morning, depending on your location. I am Charmaine Fuller-Cooper, a field manager with our national campaigns team at AARP. I am delighted to spend some time with you today on a topic that everyone is discussing. While much of my presentation will center directly on voter engagement, it definitely intersects with long-term services, which I will also touch on today because I recognize that many of you are also caregivers. I look forward to questions at the end, and from some of the advanced questions I've already received, I know this will be a very engaging conversation. If for some reason you have a question that I am unable to answer today, I would like to share my email address now so that I can follow up, or better yet, have one of the wonderful experts at AARP follow up directly with you. My email address is cfcooper@aarp.org, and we will include it in the chat. Once again, it is cfcooper@aarp.org, and I welcome any questions that you may have after the presentation. So let's get started with a great discussion on AARP's efforts to keep you informed during this 2020 election cycle. 2020, we all know, is a historic election year, and we recognize that there's much at stake. As our nation battles a health pandemic, the health and financial security of millions of Americans 50 plus is on the line. Candidates must talk about the critical issues that matter to us. So today's briefing will cover AARP's Protect Voters 50 Plus campaign, which is a campaign designed for all of us. AARP's 2020 voter engagement campaign is called Protect Voters 50 Plus. And as I said, it's focused on helping you cast your vote safely and making sure you know all your voting options. Americans 50 plus deserve to be able to vote safely, and candidates need to address the issues that matter to us. And when we think of residents in long-term care facilities, everyone in those facilities who is eligible and has a right to vote, we must address those issues and help them. We must all work together to protect the right to vote for everyone, including those in our long-term care facilities, and to make sure that state policies protect and allow, especially during this pandemic, the right to vote. AARP has a proud 34-year history of nonpartisan voter engagement, providing voters with information on where the candidates stand on issues important to our members and their families so that we can all make the decisions that matter to us. AARP is working hard to make sure that the 50 plus voter is heard. So what's at stake? I've hinted at it a little bit, but what is at stake in 2020 during this year's election? We have 5 key issues that AARP is focusing on this year. No guess, strengthening Social Security is a top issue for the 50 plus community. AARP will never stop fighting to strengthen Social Security and make sure that hardworking Americans like you get the benefits that you've earned. Now, with so many Americans struggling to afford health care and other basic needs, Social Security is even more important. And AARP will not stand by any effort to cut benefits or leave Social Security on shaky financial ground. In fact, in 2017, the median earnings of working age American Indians and Alaskan Natives who worked full-time year-round were about $36,000, or $12,000 less than the $48,000 earned by the full working age group of people. We recognize that this decrease in earnings for working age American Indians impacts us for the rest of our lives. It means that being able to afford essentials and basic needs in retirement years are more difficult to come by, which means that things such as making sure you have safe and affordable access to health care is more difficult, and things such as making sure that you can afford your prescription drugs are difficult as well. So what are some of the other issues in addition to AARP fighting to strengthen Social Security? Well, Medicare. So protecting and strengthening Medicare. Medicare is more crucial than ever as Americans face that 1-2 punch of the coronavirus's health and economic consequences. Being able to provide affordable health care for 62 million Americans 50 plus and people with disabilities is why we need Medicare to stay strong. Hardworking Americans pay into this Medicare program our entire working lives, and we count on these benefits to help make sure healthcare is accessible, but also, keyword, affordable. And AARP is committed to strengthening this key program. So we recognize elders are living longer, but a long life that has lots of chronic illness and disabilities impacts us all. And we see that in the American Indian community, we experience higher rates of chronic illnesses, diabetes, cancer, heart disease, which can make self-care even more difficult and even more so when we age. So we've discussed strengthening Social Security. We've discussed strengthening Medicare. But one of the key reasons many of us are on this webinar today is because we've seen the direct impact of long-term care issues in our nation. And we saw those issues even before the coronavirus pandemic. But the coronavirus pandemic has exposed many gaps that we've witnessed in our long-term care system. The coronavirus pandemic has left a devastating impact on families. It has claimed the lives of more than 70,000 residents and staff of nursing homes and other long-term care facilities. I was recently on a call with our New Mexico State office last week, and one of the things that we discussed was the devastating impact that the Navajo Reservation had experienced related to coronavirus. And we recognize that these devastating impacts repeat themselves over and over again throughout residents throughout reservations and communities throughout the U.S. Americans 50 plus and others in need of long-term care face a patchwork of public and private services, costly institutional care, and rely upon unpaid family caregivers. We must improve care in our long-term care facilities. We have to expand access to home and community-based services, and we must provide greater support to family caregivers. So what's AARP doing? Because all of this is very much in relationship as well to our election that's going to occur in the next 5.5 weeks. We have 53 state offices at AARP, including DC, Puerto Rico, and the Virgin Islands. Just recently, our Arizona state office collaborated with their Secretary of State to develop clear recommendations for county elected officials to assist voters in long-term care facilities. Across the nation, in our DC state office, staff are working closely with their DC Board of Elections to educate frontline workers, and not just the administrators, but truly the frontline essential workers in long-term care facilities on voting rights, and to make sure that they are aware of election laws in DC. Laws vary in each state, but health authorities, election authorities, and facilities should work together to develop guidance, just like in Arizona, to ensure that everyone in long-term care can exercise their right with any assistance that they need and do so safely. Anyone who wants to vote and has questions on how to vote should contact their state or local Board of Elections or Secretary of State. If you're a family caregiver and you want to know how to make sure that you can assist your loved one in making sure that they can vote, we also encourage you again to contact your state or local Board of Elections or your Secretary of State. If you don't know where to start, a good place to go is AARP's Election 2020 website. That website is aarp.org/election2020, and I'll repeat it throughout the session today. So, we've spoken about Social Security, Medicare, long-term services. But one of the key things that we recognize as health and chronic conditions impact us all are the need to be able to get our prescription drugs and our medications. And we recognize that skyrocketing prices are putting vital prescription drugs out of the reach for many Americans 50 plus. Many people with pre-existing conditions are having to choose between paying for their life-saving medicines and other important needs. AARP is fighting for greater accountability and transparency to stop big pharmaceutical companies from price gouging patients and also taxpayers. And I know many of us have had to deal with trying to make those decisions of, do I pay for groceries or do I buy my prescription drugs? Do I pay a little bit more for the healthier food that I know will keep me out of the doctor's office, or do I pay for these prescription drugs? So this is an issue that AARP will never stop fighting to lower the cost of prescription drugs. But most importantly, we need to make sure that candidates hear us on all of these issues. So we have 5 key issues at stake that AARP's Protect Voters 50 Plus campaign is focusing on. And the last one is securing the economic health of Americans 50 plus. We understand that unemployment during this coronavirus crisis has reached the highest levels since the Great Depression, and older Americans have been disproportionately affected. AARP is demanding action from our elected officials to protect both the health and financial security of voters 50 plus, ensuring that older workers and even our family caregivers who are also working in addition to being family caregivers can recover from the economic downturn caused by the COVID-19 pandemic. These are just some of the issues that we're focusing on this year during our AARP's Protect Voters 50 Plus campaign. But AARP is continuing to work on a plethora of issues, from making sure that you have access to high-speed internet to help reduce isolation, and to also make sure that you can keep your utilities on as we all endure this pandemic. AARP continues to fight. So AARP most importantly wants to help you cast your vote safely and make sure that you know all your voting options during this election. So where can you go for additional information? AARP has a website set up for you. It's aarp.org/election2020. What can you find on this website? And is it limited just by age? No. First, you can find key election information from recent battleground polls in states that will likely decide some of the key Senate races, as well as the presidential race in several states. You can share this website with friends and family members regardless of age. And one of the critical pieces that you can find on this website as you scroll down is a link that takes you to the voting page for your state. Every AARP state office, all 53 of them, have individual state pages that you can review your voting options for your state. And you may say, my state has court cases going on, or our election law is still up in the air. AARP staff are working constantly to monitor changes, and if not, monitor changes to those state election laws to keep those pages updated for you. So again, please feel free to visit aarp.org/election2020 to review some of the key issues that I've discussed, to take a deeper dive into several of those key issues, to review battleground polls that were just released last week in several of the key states, and most importantly, to know and also share your options to vote safely in this fall's 2020 election. At this time, I would like to take a moment to thank you for listening through my presentation, but I would love to give the opportunity to actually give you time for Q&A. So at this time, I'll turn it over to Julie so that we can hear some of the great questions that you may have in the chat.
Great, thank you, Charmaine. So for those who have questions, go ahead and type those into the chat box. And the chat box is located at the bottom of the Zoom menu bar. Also, if you'd like to ask a question aloud, go ahead and raise your hand, your virtual hand, and we can unmute your phone line. And so I see that we already have someone that's wanting to ask a question aloud, so we'll go ahead and unmute their line. Okay. Beta, do you want to go ahead and unmute your phone line and you can ask your question? Okay, just one more time. So Beta, it looked like you were interested in asking a question aloud. If you'd want to go ahead and unmute your phone line, you've been given that permission. Okay, so we'll go ahead and just move on to another question at this time. Beta, if you are ready, go ahead and just let us know in the chat. The next question is, can you expand on the AARP resource page that states the voting information?
I sure can, and fortunately, since we are able to be in a webinar format today, I will also go to that page to take you through some of the key things that are on there, if that's something that y'all would like to do. So for 1 second, and as I'm pulling that page up for you, and I will share my screen, but that's a fantastic question. And let me know when you're able to see that screen. So are you seeing the aarp.org election 2020 site with that 1-2 punch on your screen?
Yes, we can see it, Charmaine.
Fantastic. So this is AARP's Election 2020 website. And as you can see on this particular site, it shows our AARP poll results that were just released last week that showed that in several states, the election is pretty much a toss-up. It's up for grabs in several key states. Some states indicate, from some of the people who were polled, indicated that they were truly divided in key states as to issues related to the coronavirus and Social Security, but also too, to several questions related to the divide between law and order and the social protests that we have seen going on throughout the US. As we go further down, when you look at this website, you'll see even more information about recent polling. You see a great message from AARP's CEO, Joanne Jenkins. I will go down a little bit more. The website, the article under issues that will determine how 50+ Americans vote, that will show you some of the issues I spoke to you about today, including the economy, Medicare, Social Security, prescription drugs, but really go a little bit deeper into each of those key topics as well. One of the issues, surprisingly, that we get asked a lot about at AARP is medicinal marijuana. And so you even see an article related to marijuana being a ballot initiative in some of the states. Another key issue for many people is drop boxes and where can you safely vote during the election, or are there enough poll workers during this election? So again, we have information related to that too. AARP, I will add, has collaborated with several organizations to really help bring awareness to the fact that more poll workers were needed this year, and so that we can have an intergenerational approach to making sure that people of all generations are engaged in voting, not just voting, but also working the polls this year. As I go further down, you see that in several states, there's talk about a growing federal deficit, but also there are deficits that may occur with some of our state budgets as well. This particular article that you're seeing in the top left corner on your screen speaks about how the federal deficit could impact the future of Medicare. And the top right article also talks about what the election's impact could be on rising drug prices as well. And again, an issue that I didn't touch on is Medicaid. And a key article that we have is what will happen to Medicaid after the election. So as you can see, AARP has been hard at work. We have a plethora of information on this site, but one of the things I want to make sure that you see is where you see the US map in the top left corner. It's an article on how to register and vote in your state. And so when I click on this link, and hopefully it works well for us, and it did not crash. When I click on this link, it takes us toward the article of a deeper dive of how to register and vote in the 2020 election in your state. And as you can see, I'll scroll down slowly, and you start to see the maps of each of our states. And as you see these maps, you can get to your states, and you can click on, I will pick Colorado for this particular one, just to show you what you will see when you go to the page. And each page is a little bit different. And so this one right here, this page for Colorado is showing that voters can still go to the polls and vote through November 3rd if they choose. And that in Colorado, the state automatically sends every citizen an absentee ballot, and almost all Coloradans vote by mail. So that's a luxury that several other states may not have. In some states, you actually have to call your elections board and apply to get a ballot. And then even when you get your ballot, there are certain other criteria that you also have to meet. But as you can see, as you go through Colorado's election page, it tells you how do I register to vote. They even allow you to register online in the state of Colorado. They allow you to download your registration form, or they allow you to hand deliver it to your county clerk. And they also have links to each of these things so that you don't have to go and search online or search for another site to find out where to go. So you can click on the Department of Motor Vehicles. You can check your voter registration status online, which yesterday, September 22nd, was National Voter Registration Day. And I do encourage each of you to make sure that you check your voter registration either online or by calling or contacting your Board of Elections office to make sure that they have your updated address and that everything is ready to go when you choose to vote safely this year. So I believe that answers one of the questions, Julie. And as you can see, as I scroll down, and before we prepare to take the next question, you can see even information on when the polls are open, the times that the polls are open, if people want to vote in person, the dates that they can vote in person, a link if you want to find out where the drop boxes are that you can click on Go Vote Colorado's site. And again, this is just for one particular state. So if I were to click on a different state, as I went through that Election 2020 website, you would have also been able to see information from those other states as well. But I hope that this is helpful for you as well. AARP also has a wonderful AARP bulletin. It's our newspaper. And in each of the state's bulletins that have been sent out, we have made sure that it has state-specific information as well on how to vote and what your voting options are in each of the states as well.
Wonderful. Thank you so much for that information and walkthrough of the site, Charmaine. So one of the other questions that we got, this was before the webinar, so as people are registering, you had an opportunity to ask questions. One of those questions that came through was, how are we going to help the most vulnerable seniors in this transition to change?
That is a fantastic question. So we know, one, that many of our family caregivers and advocacy groups are already doing this every day. So the first piece is empowering our family caregivers with the information and resources that you need for long-term care. This includes making sure that you have access to AARP's Caregiving Resource Center. That Caregiving Resource Center, you can access it at aarp.org/caregiving. Again, that's aarp.org/caregiving, or even visiting AARP's Caregiver Support Line. And that Caregiver Support Line is 1-877-333-5885. Once again, our Caregiver Support Line is 1-877-333-5885. AARP has also compiled Prepare to Care guides that we have done in collaboration for several years now, even with other organizations, on key issues facing family caregivers and our members as we all age. They include family caregiving tips, information on where to find services, tools and resources for family caregivers, and a plethora of other issues. One of the things, I know we're talking about voter engagement. So if you are experiencing any issues in your particular state related to making sure that your loved one can vote safely, if there are any cognitive issues and you have questions on the ability for your loved one to be able to still cast their ballot, we definitely encourage you to reach out to your state or local board of elections for those particular questions, because we know that those issues, the answers can change in each state based on those state laws. I do want to also share with you today that related to the coronavirus, AARP state offices sent out 6 questions that family members should ask if they have a loved one in a facility, related to advocating for your loved one in a facility. And I'll go through those 6 questions for you. They were, if your loved one is in a facility, should you ask that facility? The first question is, has anyone in the nursing home tested positive for COVID-19? This question is totally related to transparency. We wanted to make sure that you and your loved ones had access to real-time information. The second question we shared with family caregivers to ask nursing facilities is, what is the nursing home doing to prevent infections? How are nursing home staff being screened for COVID-19? This means, especially when they enter and leave and re-enter the facility, are they still being screened? This goes to what precautions are in place for residents who are not in private rooms. The third question that we put into a list that family caregivers could ask related to the pandemic is, does nursing home staff have the personal protective equipment or PPE, like masks, face shields, gloves, gowns, that they need to stay safe and keep their patients safe? And this question really went to the heart of, have nursing home staff been given specific training on how to use this personal protective equipment? And if no, what's the plan to obtain this PPE and the proper training? The fourth question that we educated and armed our membership and our collaborative partners with to ask nursing homes is, what is the nursing home doing to help residents stay connected with their families or loved ones during this time? And I know this has been really a gut-wrenching question for many of us. And that goes to, does the nursing home help residents call their loved ones by phone or by video call? One of my mentors, his wife has had multiple sclerosis for much of their marriage, and they've been married over 40 years. And this has been a really difficult issue because his wife is now legally blind. And so she had to have assistance from someone to make sure that they could help dial him, but also too, being able to actually see her when they were able to FaceTime him with a tablet so that he could actually see for himself and be able to see, okay, does she have a smile on her face? Is she feeling better? Is she well manicured? Is she dressed properly? So that he can really observe the whole setting around her, help to reassure him that his wife was being properly cared for. The fifth question that we armed our membership with is, what is the plan for the nursing home to communicate important information to both residents and family members on a regular basis? So not just every 2 or 3 months, but on a regular basis based on what was important to you as far as timing. And lastly, is the nursing home currently at full staffing level for nurses, aides, and other workers? And this question was important because it went to the heart of, what is the plan to make sure the needs of nursing home residents are truly met, such as bathing, their meals, medication management, but importantly, social engagement, helping to reduce that isolation, especially if that nursing home was experiencing staff shortages. What was the backup plan? And we wanted to make sure that our members knew that if you had an issue with the answers that you received to any of these 6 questions, or if you didn't get an answer to these questions, that you could contact your state's long-term care ombudsman to assist you on answering these questions. So that's some of the key things that AARP is doing right now, just to make sure, related directly to the coronavirus pandemic, that there is advocacy in long-term care facilities. And we've also engaged in an aggressive legislative campaign in many of our states too, to address key policies to make sure that transparency existed and that there was safety for residents in these facilities as well. I see in the chat, someone asked to send the phone number again. So thank you, Shannon, for sharing that phone number again in the chat. Julie, what other types of questions do we have? I'm enjoying being with everyone today.
Yeah, so again, just go ahead and type your question into the chat box directly, and we can address that. Charmaine, we do have another question that came in before the webinar, and that question is, what might AARP organizationally do to embrace people under 50 who significantly assist or advocate for seniors?
That is a fantastic question. So if I understand it correctly, is how's AARP basically engaging with people under 50 to engage on this campaign? One of the things, and not just this campaign, but in general in all things that we do. So AARP has aggressively collaborated, and I shouldn't say aggressively, that's not a good word, but AARP has been very intentional about collaborating this year with other groups to help make sure, one, as I mentioned earlier, we have an intergenerational approach for making sure that we're educating people on the importance of voting, educating our membership and others on how to safely vote and how to know voting options, but also educating people that we need poll workers from all generations, because many of the poll workers who traditionally worked their election sites aren't able for many reasons to work the polls this year. So that's been one way. AARP also has a wonderful internship program for individuals who would also like to work more internally with our AARP efforts, whether that's learning how to legislate and advocate for issues that we all care about, whether that's knowing the communication side or the technical side of our work, or really learning and understanding more of the research and the aging research that AARP does as well. We've aggressively, with National Voter Registration Day, many of our communications that we're sending out, even as recently as yesterday, have focused on making sure that we're talking to our membership about not only passing information amongst themselves and their family members of people over 50, but really having honest conversations about the history of voting, the importance of voting, and what went on. So we recognize that 100 years ago, there was a women's suffrage movement, and a lot went into that suffrage movement as far as who was included, the rights of individuals who were able to vote, how women came upon their right to vote, but also how communities of color were still impacted or delayed in their abilities to vote for years beyond that. So being able to have these conversations with younger generations to motivate everyone to be engaged and actually just build more camaraderie and build more memories between family members just on talking about subjects of voting, but also key issues. So that's an important issue for all of us that we need to talk about of, how do we make sure that this is not a campaign that's just limited to the 50 plus, because everything that AARP does is about all of us and engaging not only the 50 plus, but also family members. So great question.
Excellent. Thank you so much, Charmaine. So again, if folks have any questions for Charmaine, please type those into the chat box. This has been a really engaging question and answer session, so I'd really like to keep this going. And again, if you wanted to ask a question aloud, go ahead and use the raise your hand feature, and that will indicate to us that we can give you permission to unmute your line.
And also, too, while we're waiting to see what other questions may be in chat, I do want to share that AARP has heard from thousands of family members with heartbreaking experiences with caring for their loved ones, especially during the pandemic. We recognize that many people may not have the connectivity that they need. They may not have the transportation that they need. Early on in the pandemic, and even now, many people didn't have the protective equipment of just having face masks and gloves if they needed to go out, or just the basic financial resources that were needed. And we continue to hear from loved ones. If there is a key issue that we can help any of you with, I again encourage you to email me at cfcooper@aarp.org if I can answer any key questions of how to connect you to the information or resources in your particular state. But AARP has been listening to the concerns of our membership and family members as it comes to the pandemic. And from the chat, I'm not seeing a lot of questions, so I hope that means that the presentation was wholesome and that I answered many of the questions that you may have had. If there's something else that you would like for me to answer, or another key resource related to AARP's Protect Voters 50 Plus campaign that you have questions about, I'm happy to go into that as well. Again, AARP is a nonpartisan organization. And I do want to emphasize that because AARP does not endorse or oppose any candidates, and we don't give any money or financial contributions to any candidates. If you've ever seen AARP's name or logo mentioned or visualized on a campaign ad or commercial or a radio ad, that was done without AARP's authorization. And AARP, as soon as our members and volunteers and folks from the public let us know that our name has been mentioned in any type of political ad, we immediately take action because we truly are nonpartisan and we're about bringing you information that matters to you on issues that you care about.
Great. Thank you, Charmaine. I think we have one last question, and then we'll go ahead and wrap up our session. And so this question is asking about support groups for caregivers. If there's any of that AARP, any sort of support or information about that.
So there are support groups for caregivers. One of the key sites that you can go to for information is actually the caregiver support line. And that line is actually listed up in the chat, but I'll repeat it again. It's 1-877-333-5885. And again, that caregiver support line can be very helpful to you. Again, that's 1-877-333-5885. I know from my previous life and in a state office capacity with AARP also recognizes that the life of a family caregiver can sometimes feel very isolating because you can't get out and do some of the things that you may have done before, but also too, it's a job that comes with a lot of love and compassion, but sometimes you need rest and you also need a break. And AARP at our state level has also fought for respite resources, meaning programs that allow you to be able to have those breaks and take those breaks. That's a great line to contact if you want to also find out about those respite services in your area, or reaching out directly to your AAAs, your area agencies on aging, or your council of government to find out what type of resources they also have for respite care and other services for family caregivers.
Okay, excellent. Well, I'd like to thank Charmaine for, I'd like to thank Charmaine for joining us today and sharing information about protecting and supporting voters 50 plus. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.